The Department of Health is responsible for the health and safety of the citizens of St. Louis, and that includes staying abreast of health issues facing our community. Joining us are Government Services Analyst Schmid and Epidemiologist Nile Garba. Welcome, Nila. Did I say that right? I've been practicing. Well, welcome both of you. And the Department of Health serves many, many purposes for the city of St. Louis. And right now, we're facing an epidemic of sorts it's like all in the news, and that is substance abuse, and particularly opiate and heroin addiction. So, Nila, you're kind of in the thick of that, right?
Right, yeah. So, while nationally, heroin use has been increasing over the past several years, and along with that, heroin overdose fatalities have increased in the United States. So, in the last 15 years, the rates have quadrupled. And similarly, the city of St. Louis has been experiencing the same trend. So over the last 5 years, our numbers have tripled. And in the last year alone, there was a 90% increase in the number of opiate overdose deaths that the city, that occurred in the city. Mm-hmm. So there were about 256 opiate overdose deaths just in 2016. Mm-hmm. So heroin is a very dangerous, harmful drug to the body. It can cause the breathing rate to slow down, it can cause the heart rate to slow down, and when it's combined with other drugs or alcohol, it can really compound the effects of the drug.
Mm-hmm. And you're tracking, your statistics are based on deaths from heroin and other types of opiates. Is there any way to track the level of addiction in our community, or is it just based on the people that are dying from it?
So we see the number of people who have died from overdose deaths in the city, but we can also look at emergency room visits as well. So we do see that there is emergency room visits for heroin overdose that do occur, and we can also look at that geographically. So when we look at heroin overdoses who went to the emergency room, we see that there is an increase in numbers in the southern portion of the city, and that's also similar with the heroin or the opiate overdose deaths as well. We see that there is an increased number in the southern portion of the city.
Okay, so why is that? Do you have any idea why that part of the city we're seeing an increase, and what are we doing about that?
Well, it may be because there's more easy access. It may have something to do with the interstate, Highway 55 being down there. So that could be a couple of the reasons.
Demographics, population, are those things that you all study as well?
Yeah, so when we look at this mortality data for 2016, we see that both African Americans and whites are affected. Whites are affected a little bit more at a little bit of a higher percentage. The average age for 2016 was about 40 years old. And then we also see that more males are affected than females as well. Mm-hmm. But we have also seen a trend of more females also using the drug and experiencing overdose fatality in the past several years. Mm-hmm.
So is this something that's getting a lot of attention within the ranks of the city, would you say?
Yeah, I would say that. Mm-hmm.
Well, we're going to talk some more about the prevention, intervention, mm-hmm. and treatment. And so the city of St. Louis has been working with St. Louis County. Mm-hmm. I know a lot of times people don't think that the city and county work together, but we do very much. Mm-hmm. And so we have the prescription drug monitoring program, which is one of the prevention pieces. It's viewed as one of the best practices. St. Louis County started this program, and the city of St. Louis is joining them because 50 other states in the Union have this program, as does Guam, which is a territory of the United States, but we don't have it. And so we've begun that program. It will allow us to track the dispensing of opiates and other medications as well. So
and that's starting now?
It will be starting and going live on April 25th.
Okay, that's a big day and an important
day
for the state of Missouri. Statewide?
Yes, it is. And we are hopeful that the state of Missouri will join St. Louis County and St. Louis City in that effort, and the other counties, including part of Kansas City, will be part of that.
Mm-hmm. Very good. All right, we're going to take a quick break, but when we come back, we're going to have much more with the City of St. Louis's Department of Health after this quick break. Thank you, and stay with us.
Great.